Welcome to our part 2 podcast with Keri Graff. If you haven't seen part 1 of our podcast, you have to go back and watch. We had so much that we learned and so much good content that we asked Keri to stay a little longer so we can make 2 episodes. So if you haven't seen that, go back and watch, but welcome to episode 2. So Keri, is there an age where hormone replacement should stop?
I love that question. I personally intend to never stop using hormones.
Hey, okay.
So I'll share my own story with that. I had hysterectomy in September.
Okay.
Immediately before I even left the hospital from my surgery, I had my mom slap an estradiol patch on me. I never had a hot flash, and I actually feel 10 times better. My resilience is broad now to execute the things and that I want to and need to, and to be in the spaces that God's called me to. And my bandwidth is way wider. I just feel super balanced, and I feel really me, which feels really, really great, which perimenopause didn't. I feel like I got off a roller coaster. I don't ever want to go back if I don't have to.
Absolutely.
Now, the true answer to that question is use hormones until you don't want to. Say you start on a bioidentical journey and you want to take them until you're 87 years old and, wear a patch or use a cream until you're 87 years old. By all means, knock yourself out. There's a reason our nursing homes are full of women with dementia. There's a reason why our cardiovascular risk in women and cardiovascular events is very, very high. It's the number one leading cause of death in women. And your heart is very much an estrogen receptor. There's a reason we have a lot of osteoporosis and hip fractures in our nursing homes, and that's debilitating to women. And I don't know about you, but if I'm going to be here, I want to be able to be independent. I want to have my brain. I want to have my faculties about me, and I want to be able to engage to the best of my ability for as long as possible.
Absolutely.
So from my lens, my hormone lens that I see the world through, I intend to use that as long as I can. But it's, again, always nuanced and totally your choice it's your body, your choice.
I appreciate that. I think I have seen information that's out there that there's a certain age where if you haven't started hormones by this age, do not begin them because it puts you at a higher risk for heart disease. It's interesting, some of these things you just mentioned. What would you say to that?
Yeah, it's a great question. So after 10 years, say you go naturally into menopause at the age of 50, and now you're 65 and want to start hormone therapy. Does that take you off the table? Absolutely not. This goes back to the very nuanced part of this conversation. It all comes down to what are your symptoms, what are your risk factors, and it has to be evaluated by a clinician, very individualized. That's where I really like the MIDI conversation when they're prescribing hormones. There's very little negative effects when you're replacing like DHEA, something really simple like that, or progesterone. They're really low adverse events with either of those. But estradiol is a different beast. Remember, I told you she's the queen, and she's, a little fussy. She's kind of Goldilocks. So it has to be treated very, very, very individualized and all things. But, it's really a quality of life conversation that has to be had with a trained professional.
Okay. So the dosage is important as well then.
Yep.
So like I've seen there are some where like, just get this cream and it's got all this stuff in it and so forth. That isn't dosage specific to the symptoms somebody's having. So that would be an argument for maybe some of those things that you can see just scrolling through. This is the hormone cream that will solve everything. Well, it's not dosed. And so maybe it's not
right.
specific or okay.
Yeah.
Great. I'm sorry. I think I interrupted you.
No, I was just going to say she mentioned until you don't want to. So why would you not want to?
That's a great question. That's my favorite question because I don't know why you wouldn't want to personally, but that's not everyone's story. If you have an increased incidence of blood clots, that immediately puts you in a different category with estradiol replacement therapy, and only bioidentical. I want to just say, I'm never a fan, and this is just Keri saying this. I am not a fan. I don't see great results, and the research around bioidentical versus synthetic hormones is very different. Now when I talk about synthetic hormones, I'm talking about like Premarin and Provera that we used to use. And thankfully, when we know better, we can choose better. But bioidentical is body identical. That is horsemare urine, and it's made from horsemare urine, I should say. And
From what? What did you just say?
Horsemare urine.
Horsemare.
Yeah,
urine.
Premarin, horsemare urine.
Wow.
I didn't know that.
I didn't know that either.
I still see women walk into our office with Premarin in their hand. And I also see women as recently as the last month come in on Premarin, and which is a synthetic form. It's made from horsemare urine of estrogen. And most of the time they're not in a great place, and they've potentially been on it for that is a provider, in my opinion, I want to be very, very diligent in saying that, in my opinion, that's a provider who hasn't been updated on the newest data, research, and options. This is probably also a good time to share about how it is used. So you were mentioning creams and that kind of thing. So for estrogen replacement therapy, it is available orally.
Okay.
That has a different profile though. So this is again why a trained clinician would choose if you're going to do it orally or topically. There is more increased risk of blood clotting and different risk factors from an oral estrogen because it has to be metabolized through the liver first.
Okay.
When you use it topically, it does not get metabolized through the liver.
Okay.
I wear an estrogen patch. That's worked great for me. That's my story though. Where the next person that could be very, very different for. You also can get it through a compounding pharmacy. My mom actually works out of a compounding pharmacy, so I've had the benefit to kind of watch that behind the scenes. I'm fascinated by that. I love the individualized part of that. I'm not quite using that yet, but I know that it's an option for me later if at some point the patch, I had an adverse reaction to the adhesive or just in any way that my body rejected that, there are other options that you can apply it daily. So there's some benefits there sometimes. It just, again, has to all be weighed out individually with a trained clinician who's prescribing that. Same with progesterone. So progesterone is a little bit different. That can be applied topically or orally. When we use it orally, it hits the GABA neurotransmitters of the brain, which is your calming neurotransmitter to the brain. So it helps with sleep and a reduction of anxiety. That's my one I was talking about earlier about it. You'll have to pry it out of my cold, dead hands. Like, bury me with my progesterone, please. Anxiety and lack of sleep are my biggest things I don't want to deal with in my life. They rob me of joy and make me a terrible person to be with. And so for those around me, I like.
And if those aren't right, then the rest of the world's not right.
That's right.
Yeah.
Yeah. Testosterone is typically applied topically. DHEA is actually a supplement. It's a hormone, but it's a supplement. And in women, we usually start on a very small dose, like 5 milligrams. And that can go out. You can get it. Like, please be careful about where you're getting your supplements. Like, don't go to Amazon and buy your supplements. They're not third-party tested. And when you're dealing with things like DHEA, it's really important that you're choosing a quality supplement brand.
That's a great point that you made. Two things: under advisement of a clinician, and where you get them from.
Yeah.
So
Not the
hear this
influencer.
and just go to Amazon and get your own things and try it out. Not going to work out well.
Yeah.
Yeah.
Yeah. And it's tempting. Like, I think influencers out there are, this balances your hormones, or no, this balances your hormones. And sure, well, some of that's true, again, because it's so individualized and nuanced. It just gets dangerous sometimes. For one person, it might be great. For one person, it might make it worse.
You mentioned that you wear a patch. How frequently is that changed?
Great question. Twice a week.
Twice a week.
Yep.
Okay. So
Yep.
a certain number of days and it's all been absorbed. And so you take it off, and do you have to rotate where it goes?
Yeah, ideally.
Okay.
Yep. Like on an area of your body where you don't see. I wear mine like on my low abdomen, or you can put that on your side back. You can do back of the arm sometimes. Creams get applied like inner thighs, low abdomen, back of the arms. We use a progesterone cream in our office also that is called Balance Cream. Dr. Anna Kabeka, who spoke at our last conference, she's one of my favorites if you're ever looking for someone to follow. She just is such a heart worker. I will forever sing her praises just because I know where she comes from, meaning like she has a beautiful heart posture, I guess is my point. So I'll forever tell people to follow her because she does such a beautiful job. But she creates a product called Balance Cream.
Okay.
And that's topical progesterone. Now, it doesn't hit the neurotransmitter GABA receptor, but it has a lot of helpful. This is more, I see it work really, really well for someone who doesn't really want to use bioidentical hormones, or they're just not there yet. And it is a bioidentical hormone though, but it's just super safe. And for women who are still menstruating and just need a little bit to kind of balance off that excess estrogen. Remember, they like to play together. So when you bring that progesterone up.
So we talked about how in advanced age, it's to continue to use hormones is okay. What about the other end of the spectrum? Like how young a woman should consider something like that or not, or?
Yeah. So nuanced because it depends on the story. So our PCOS girls might need additional support with things like myoinositol, dechironinositol to help bring those androgens down. There's a lot of different supplementation supports to balance off those excess androgens that we talked about, like during Dutch testing. If their testosterone levels are elevated, it's going to cause like facial hair for some of those girls, a lot of acne we see in young women. So as early as that to help support it. However, I have recently learned through some of my hormone mentors, for example, like Dr. Keri Jones, that in perimenopause, we're wildly underdosing estrogen, estradiol specifically. So a lot of women could potentially use it sooner than later. They're starting to have a lot of wild estrogen fluctuations. So sometimes starting them on a very small dose through a cream or a patch will often make their perimenopause symptoms not as debilitating if necessary. Again, very individualized.
So it avoids the crashes. So maybe you don't get the highs. Is that the idea? Because if it's sometimes, like if it wildly oscillates, is the idea that like, well, if we can supplement when they're low, maybe the body will normalize and I can't stress enough, it is just so individualized. That's why you have to have a good provider that knows how to do this, like
so
MIDI.
You don't have to wait
not necessarily. Like I would, in perimenopause transition, you go from, we typically in our reproductive years have a very typical natural cycle that's 28 to 30 days, give or take. It's a nice, fluid, typical, predictable pattern if you're having normal periods, which you'll find is pretty low percentage.
So maybe what's one of the biggest things that you would tell women, what questions to ask, what advice to seek earlier on to be proactive before they hit all of these horrible perimenopause symptoms?
Yeah. It's just the foundation. It goes back to sleep, stress, fitness, nutrition, and hydration. If you can just be diligent every single day about intentionally keeping those 5 things balanced, you will have a much better outcome. I like to use, at our last hormone conference, I used my best friend who has a very predictable life. She's had the same job. She's a teacher. She teaches kindergarten. She's always taught kindergarten. It's the same. She lives in the same house she's lived in for a long time. She's married to the same man she's always been married to. And she does the same thing. She goes to the same church. She drives the same car. She might update it, but it's the same. I'm being extreme there, but you get the idea, right? She just has a very predictable life. And I always joke, my life doesn't look like that at all. We're complete opposites. And my perimenopause journey was rough, but there was so much change that from even an early age I had a lot of change, and she did not, and her perimenopause experience has been much more manageable than mine was.
Interesting.
Wow. She also treats herself like a toddler and goes to bed at the right time, which good for her. She has having a very fluid experience, not without some deviations, but yeah.
Wow.
I think that's the best thing you can do is just be really intentional and not overly obsessive. I see a lot of young women in their late 20s, early 30s who even become obsessive about this. And that's that ruins it too, because they're being overly obsessive. It's just a nice fluid balance. When you get to perimenopause, those estrogen levels start to wildly fluctuate, especially in the second half of our cycle after ovulation. And so on Monday, your estrogen levels tanked. On Tuesday, it's high. On Wednesday, it's middle. On Thursday, it's high again. On Friday, it's bottom of the bank. And that's that body doing a lot of things, trying to maintain homeostasis, doing a lot without doing anything. So if we can support that with just those foundation things.
Our PelviCare app has a menstrual cycle tracker,
Okay.
and with it, it has we put a bladder diary with it and things like that for women that are suffering from like interstitial cystitis or different things like that, or incontinence in general, ways that they can monitor. And there are features to it that help to like take your temperature and things like that to predict
Awesome.
ovulation and things like that as well. And an educational piece that Lee does about where you are in your cycle and how discharge or mucus will be different. And so you can kind of guess which phase you're in based on what hormones change your discharge and things like that. So we're excited for that too, to be able to help women to conceive and things like that, and just to understand their body.
Yep.
And to be empowered,
Right.
you know, so.
Yeah.
that's great.
Is this maybe a good time to move into like vaginal dryness and part of that with how PelviCare connects
Yes.
with some of that?
I do want to do that. And you said something interesting, and Lee was getting to it. Can we talk about, you said, and we went into a different topic, and Lee sort of just hit on it. Most women don't have a normal menstrual cycle, or you said something about menstruation. Can you speak more to that?
Yeah, we're just seeing a lot of variations now, and it makes me so sad. And I attribute this to, we have a lot of toxic stressors in our environments, you know, even just BPAs, plastic, phthalates, those different things. And like, if you watch these young girls on, you know, I'm going to use like TikTok, for example, they are plastering their skin with endocrine disruptors. It's so upsetting knowing when you know what you can't unsee. And we actually have had someone reach out to us and say, can you give some education to these young girls? I'm like, they're not going to listen to us. Like, we have to find somebody younger to help them. But I just think this is happening a lot because it's kind of a trend through social media. But if you have daughters, please teach them. Like, I do not want my granddaughter plastering that stuff all over her body, knowing what it's going to do to her hormones.
What is it?
So endocrine disruptors are like lotions, or there's multi-step processes. These young girls, I saw a video of, she had a multi-tier thing that she was putting her little cosmetics on. And I'm talking like a 10-year-old girl. And this is very common, Jess. They get on social media and they like do their faces and their skincare routines, and that's content for them, and they love to watch each other do it, and it's kind of cute. I get it. It's just not cute from a hormone perspective,
Right.
And the, you know, the marketers for those products make them very attractive to those young girls, and so they're, you know, I would probably be okay with teaching, I definitely would be okay with teaching them good hygiene and how to care for their skin. That's awesome. But like, be mindful about what's in those products and be aware of what the endocrine disruption is in those products, because it would be one thing to do one, but they're doing multi-step processes.
Okay.
And your skin is your biggest absorber next to your gastrointestinal system. Like, that's going into their bodies, and it is changing their hormone systems.
How is it changing their menstrual cycle? What are you seeing?
Yeah, so we see a lot of, they'll come in with really heavy periods or amenorrhea, one extreme or the other. So no period or heavy periods.
Interesting.
Yep, and they don't feel good. We see a lot of endometriosis or adenomyosis. And I don't know that that's necessarily correlated directly to endocrine disruption, but those are the things we're seeing. And they're just not in a healthy balance with their menstrual cycle. It should tell you a lot about your body with your menstrual cycle being 28 days, a really typical period. You're not going through, you know, tampons and pads. Like, that's not normal. Breast tenderness is also not normal. You shouldn't be having a ton of breast tenderness. That's inflammation in the breast.
And everyone thinks that it is.
Everyone that's why I said women are
yeah.
great at gaslighting ourselves, right? I also think part of it is, a lot of it is diet. You know, low protein diets, processed foods, Starbucks trends, you know, just the different things that they're putting in and on their bodies.
Interesting.
So less Starbucks, less contour and blend of our.
Right? Yeah. Just the even
I just think about that. That's what
cleansers
my
and-
nieces say. Aunt Lee, that's not how you contour and blend. So
Yeah.
I didn't watch the correct TikTok video to know.
That's great.
Well, that's a great warning. I appreciate that. Shifting gears, we were talking about hormones, and we were talking topically, and we were talking about creams and different things like that. You can also use different creams that help with vaginal dryness, and that was one thing we wanted to kind of address with you. Can you speak more to that topic in general and what you would like our viewers to listen or to know?
Yeah. So a couple of ways that this can be approached. So thinking about PelviCare and how you guys are supporting that and the importance of how hormones impact that. Most women over the age of 45 should be using vaginal estradiol. And I'll explain to you why. It doesn't go systemically fully. A little bit will go systemically, but it's not going to cover you from an estradiol perspective to use it vaginally as a preventative. Okay. So if you think about, I saw a video one time and I wish I had saved it and shown it to everyone, because in a private intimate setting, if you think about the female vulva from birth until death, it goes through a lot of change. This is not general knowledge to all of us, but if you think about it, I remember the first time I thought about it, I was like, yeah, it definitely does. And so when you hit menopause, things kind of shrivel up, just kind of shrivel up. Okay. And vaginal estrogen brings plumpness back into those tissue. Remember I said everything is an estrogen receptor, even there.
Yes.
Okay. So replacing vaginal estrogen, it's tough once everything is shriveled up. You can still support it definitely with vaginal estrogen, but it's best to start like at 45 as a preventative and using it from like clitoris to anus every day. Just preventative in the morning. You need to be 12 hours away from intercourse so that you're not sharing estrogen with your partner.
Good point.
Yeah. So being aware of that. This also helps, with looking at PelviCare and how you're supporting the urinary incontinence systems and that sort of thing.
Pelvic pain, right?
And pelvic pain. Thank you. Yeah. Estrogen, thinking about our nursing homes and, all the women are peeing their pants and they're getting terrible UTIs, and that is a whole thing that gets into their brain and, is debilitating. And if they're using vaginal estrogen, and if we just did this as part of our care, we could probably avoid a lot of those things. It also supports the pelvic floor.
Yes, very much so.
Yeah.
Yes.
And we do see that a lot, and where we run into roadblocks with treating some of those things like the incontinence and the pelvic pain is if the tissue is in the state it's in, we can only get that back to a certain level. And that's if the tissue is deteriorated, of course it's going to be painful with intercourse. So we have to treat the tissue alongside with building the pelvic floor strength for that or relaxation.
Right.
Yeah.
DHEA is another option. I mentioned there were two options. So we also use something called Julva Pro. There are others, but that's a Dr. Anna Kabeka product. DHEA works really well topically as well because some women have lower DHEA levels vaginally, and it's, again, very supportive to the tissues. She also has a product called Velve, which, so in our house, even our boys know this, Julva's for your vulva, and Velve is for play. So it's hyaluronic acid, and that supports also the tissue. So when they're struggling with pain with intercourse, dryness, and that's impacting their life in very difficult ways, those two products can be super helpful. But again, that's kind of like, you can very safely try that.
So let's talk about how to get that, and the importance of that, because what we see a lot of times is you don't get help for that. You develop pain with intercourse, which then turns into extreme tightness, which then turns into kind of an emotional distress, which just spirals into a way bigger thing than it needs to be and a lot harder to unwind and get back to normal after that. So how would they go about doing that? Is that back to what you said? Find the clinician that will order that. Is it more of a medication, supplement, kind of go through that?
Yeah, I guess it comes down to age when you're starting to experience these symptoms. Some women in perimenopause are already starting to experience that, or even just, in reproductive years, if they happen to be a lower estrogen female, like that doesn't mean that they won't experience some of those symptoms. It's super safe to start with the DHEA side of it in those earlier parts where your ovaries are still producing hormones. Okay. So I would start, if it was me and I was going into it, I would start with like some Julva Pro, which is available over the counter. Pro has to be purchased through a clinician, like our office has it available, but you can even just buy just regular Julva through Kabeka site. That's available that way too. So it's just readily available DHEA topical vaginal cream. Okay. The Pro is just a higher concentration of DHEA, so it works a little bit better. It's nice, it's supportive, it's helpful, you can be on any part of the spectrum in this way, just based on symptoms. What are they experiencing? Start there. If they're 45 or older, at that point, I really like them to consider, asking for a prescription of vaginal estrogen. I just think everyone, should stay in the proactive side of that to avoid all the things that you were just
to avoid snowballing into a bigger issue. I mean, you've said that again and again, be proactive. And you've given lots of good ways for us to be proactive. And I think that is what we need.
Yeah.
That's what we need across the board, is to know what to do, to be proactive and not find ourselves in these situations. Now, if we do, there's still help for that too, but how awesome would it be not to even end up there?
Yeah, absolutely. Because this becomes, sometimes this ends marriages.
Yes.
And, when we're looking at the whole person, that is not the goal.
Right.
To help. And I don't, because it's a conversation that isn't, I think, brought to light enough when I think women suffer quietly and shamefully, and that's unnecessary. Don't.
Yes, you made it to the point in your marriage and kids are raised and having babies of their own and grands and all kinds of things, and it's just a different season of life, and then to enter into that kind of difficulty is unnecessary.
Absolutely.
Yeah.
So
those different creams and things that are applied topically, that does or does not necessitate, is there still a need for supplemental estrogen sometimes? They're not exclusive, right?
Correct.
They're okay.
Yeah.
Can you speak more to that?
Yeah, you can use one and or both.
Okay.
One, the other, and or both.
Okay.
Just system dependent and, your unique situation, what your hormone levels happen to be. And testing does help that. But with vaginal estrogen, very low risk. And like I said in the beginning, most of it does not go systemic, meaning to the rest of your tissue. So if even breast cancer survivors can use that.
Oh, that's great. And so that's why it's not exclusive, is because it's not systemic, it's local. And so you may use both.
Right.
Okay.
Yeah. Obviously needs to be addressed by a trained clinician.
Right.
Yes.
Yes. Working with someone like you who can test and monitor and help you through, and I think is very important, very key. Lee touched on something a little bit about physical therapy and apps like PelviCare and things like that, where it is musculoskeletal considerations that can complement what you're doing, because there are situations where there's pelvic pain, there's tightness, a prolapse and strengthening and things like that can help along with the supplementation that you're talking about, that I think makes a 1-2 punch that really starts to come around and support a woman completely and fully. And so I thank you for mentioning that, because I do think together we can be more complete, a more complete solution for women.
Yeah. So Ashley Bailey, who's a chiropractor, she has a great talk called Before the Bump. And I'll be honest, I was kind of like, how does that fit when I'm really calling hormones? But that's that proactive side of how you can start there. And my daughter, actually, my 29-year-old daughter, said to me, I wish I had known those things before. And she has 2 little ones. I wish I had known those things so that I could, do it better, because we all want to take care of ourselves and our families and our children to the best of our ability. I think that's a real woman's heart. And you have the opportunity to do that. So yeah, we think it's just really important to also start that side of it. And I don't think that the postmenopausal woman will be bored, because we all have women behind us that we want to see be well, feel well, do well, and, live their best lives too.
Well, I think some women who are perimenopausal or postmenopausal, when they listen to that portion of the conference, they'll see, there maybe were some things that started with me that I had no idea, just sort of coming full circle, I guess, in our discussion where you talk about looking backwards, that maybe you can recognize some things in yourself that, like, oh my goodness, this is something that started way back there.
Oh, so true.
Yes.
Yes. That's a functional medicine timeline.
Yes.
And that's what we want. We want more people to learn. We want more people to share.
Yes.
Because it just brings everyone back to that, like, there's something you can do. There's that community feeling. I just love what you're doing with that. I think if, what did we say, the 300 people are plus. I mean, if they get this information and even share it with one other person, that is huge.
Yeah.
Yes.
You know,
I think we learn so
Absolutely.
much about each other through our stories, right?
Yes.
That's one of the other things that we discussed in our planning was we need to share stories too of,
Yes.
success stories so that we can find ourselves in, our peers' stories, and that really helps instill hope and also encouragement and motivation and just like it's possible.
it is.
Do
yeah.
away with shame and embarrassment and instead
Amen.
just,
Yes.
be clothed
Exactly.
in strength and dignity and laugh at the days to come. It's
Oh,
possible.
I love that. Yeah. Well said. Always.
So if someone wants to, doesn't live in the area where you practice, they can access you.
Yep.
Talk more about that.
So I do virtual visits as well.
Okay.
My mom is in Florida and sends me clients every day, all day. So I'm very well versed at connecting with, people outside of our regional area here. And yeah, I used to ask myself, do I feel like I get a better result when I can see someone in person? I think technology is great that way. I can still see what they're not saying. I try to watch for cues in their body, and, with a virtual visit that gets executed just as well.
That's great.
And really helps bring in resources.
And how do they access you?
So the best way is to connect with us through our office at Totally Natural Techniques. Our website is totallynaturaltechniques.com. Just call the office to schedule.
That's great. I'm so excited about what you're doing. I echo Lee that just like to think about the hope and that we can recognize ourselves in like kind of join the other women that are out there struggling with the same thing, join the human race and get some real help is really encouraging. So thank you for today. I appreciate it.
Yeah, thank you
What
for all
you
you
do
guys
is
do too.
amazing.
Oh, you too. Yeah, we're so blessed with a good, awesome community of women, and just love how we all, keep each other focused and keep, what God really wants out of all of us to help each other. And
Absolutely.
yep,
Yes.
it's lonely alone. We're here to help each other.
That's right.
right.
Yes. Yeah. If we can let go of shame, I think that's the first step in just kind
Yeah,
of
I'm so
seeking
glad
some help
keep
and
pointing that out. So
joining each
important.
other.
Yes.
Yeah, absolutely. Well, thank you again.
Thank you.
And thank you to our listeners for joining in. For more information and other ways to get plugged into a community of women who are clothed in strength and dignity and who can laugh at the days to come, please be sure to check out our website, pelvicare.com, or download our app. And we'll see you next time.